Hi, everyone, and welcome to the online lecture for Tuesday, November the 5th in our healthcare ethics class. This is going to be about 10 or 12 minutes long, not very long. But I've got a few things that I'd like you to check out. And then, as I mentioned to you, there'll be a class activity. I'll share this with you. This might take a few days for you to figure out. It's just due by Friday, November 8th. So we're starting anew in our final ethics theme, which is access, and access is going to take many forms. Um, Both today and for Thursday's class, we'll be talking about access today and health insurance, and then Thursday, access in primary care. We're also going to talk about access further down in the emergency department, and then delve into a few other topics. So access to care means different things, but let's start with health insurance. Now, I don't have a great sense of how much many of you know about health insurance. I think you probably know more about car insurance. Hopefully, you all have car insurance. But health insurance and car insurance and actually life insurance and all kinds of insurance are cut from the same mold, from the same premise that insurance exists to protect us against risk. So let's start with car insurance. And these are PDF documents that I have, so I can't actually draw on these, which really bums me out. But so I'll be talking a little bit. I guess I could go to a blank screen, but that's okay. All of you hopefully have car insurance. If you're driving, it could be through a family member, it usually is. But there's a variety of different things. I'm going to skip to the later a little later on in this page, and there's some themes that all of you recognize. Premium, perhaps deductible, co-payments. Let's start with those three things. What's a premium? Well, I'm going to interchange and talk about car insurance and health insurance. Premium is the amount of money that a person pays. It actually is something that you pay or perhaps will come out of a paycheck. You think about car insurance, those premiums are done maybe every 6 months, biannually. For health insurance, it's usually done biweekly or monthly. And it's the second line, a premium must be paid regardless if the consumer uses anything. So you think about your car insurance. Premium is just the cost of having the car insurance. Hopefully you don't get into an accident or anything happens. You still got to pay that premium. That premium is based on a variety of different things. For your car insurance, age, gender, type of car, location of where you are, how many miles a day you drive, all kinds of things. And for health insurance, it's a slightly different. It's much more of a community graded plan as opposed to an individualized plan. Individualized is what car insurance is. It's based on the person. Um, Health insurance is a much larger community base, which means you're not really measured for who you are as an individual or an age or gender or level of illness. It used to be the fact, but it's grouped together, which means one's premiums could be the same for an entire family or an entire workforce. Deductible. Deductible, the amount of consumer pays for covered health services received before their plan begins to pay. So you got to pony up something. You got to put something down. And this is an example of $1,000 deductible. Let's say that you have a healthcare bill of $5,000. If your deductible is 1,000, you have to pay that 1,000 before the health insurance plan pays the rest of it. Car insurance is the same thing. If you get into an accident and the cost of fixing the car is $2,000 and you have a $500 deductible, you have to pay that 500 first before the car insurance pays everything. So it puts skin in the game and it says, listen, we're not covering everything. You got to pay a little bit in there. It keeps the consumer honest. Let's go to copayment. Copayment is a much smaller amount. a fixed amount, anywhere between 10 and $100 if the consumer pays every time, every time for the service. Every time you go for a doctor's office visit, it might cost 30 bucks. What's the purpose of a copayment? It's to make sure that it's a necessary service that the consumer wants. Um, it's there again to put a little skin in the game. I use that term a lot because, and I'm not sure if you've heard that term before, but it really means that, if you really want this service, a prescription or something, that you got to pay up a little bit. It should be a small amount. So these are basic terms with insurance. Think car insurance and health insurance the same. So how does insurance in the United States work? I'd like you to review this document on your Blackboard site. It talks about why it's important, what types of coverage they are. The most basic thing is healthcare coverage is grouped into two general categories, private and public. And so I'm going to share another document here that talks a little bit more in depth about this um, in from our perspective. So let me bring this up a little bit. Okay. This slide is from a health affairs article, which is on your Blackboard site. I just simply took out this chart. National healthcare expenditures and health insurance enrollment from the year 2016 to 2022. That's the latest numbers we have. It's divided into basically three and then a fourth, but let's say three big health insurance buckets. Private health insurance, Medicare, Medicaid. I think I can write with this one, so I'm going to highlight stuff. Very excited about that. Okay, where am I doing this? Annotate. Go. Okay, so let's talk about the buckets here. Private health insurance. That's insurance that an employer um, primarily covers. So in order to, no, I guess I can't do that. In order to, oh, that's not working. Sorry about that. Let's go here. There we go. In order to be covered under private health insurance, you or someone related to you has to have a full-time job that provides the health insurance. My example is at USI, where I work. USI provides health insurance for its full-time employees. It essentially covers 75 to 80% of the costs, and I pay for the remaining. And because of that, my family and I, because I've chosen a family plan, receive health insurance. And just like that, many of you have health insurance through family members. Second type of major category of insurance is Medicare. Medicare is the government program that individuals age 65 and older receive because they have paid into it over the course of their working life. And it covers a variety of different categories. It's divided up into four parts, conveniently known as, here's the best part, A, B, C, and D. Medicare A, Medicare B, Medicare C, and Medicare D. Pretty creative. And it because it covers individuals age 65 and older, you can see with the enrollment, have you look at this line. Over time, that number has increased, and we know that because there are more individuals in the United States age 65 and older. Turning 65, you can see the enrollment growth, pretty consistent, but they're also living a little bit longer. So it's a very fast-growing program. Let me go back to private health insurance. You can see the enrollment as well. Let's go over here. Slightly increasing, but it also has dips. Why is that? Well, it's tied to employed workers. It is based on employment statistics, which means as more people are employed, the number should go up. But as people lose their job, let's say there is a higher unemployment rate, they will lose their health insurance. That also means their families might lose health insurance. So, important thing to cover that important thing to understand is private health insurance works in tangent with the economy. Okay, let's go to the third category, which is Medicaid. Medicaid, along with Medicare, was created in 1965. It is a combined federal and state program, but there are 50 different Medicaid programs, 50, one for every state, and it provides health insurance, 50 states, 50 Medicaid programs. So short form is Medicaid. It provides health insurance to those who are low income. And so let's look at the enrollment numbers from 2016 on. That number also fluctuates, but you can see the growth, especially from 2016 to 2022. It's increased substantially. That's because different states have changed their Medicaid programs to allow for more state residents to enroll. And you can tell something interesting happened in 2021 with that. So it is a program that covers individuals who, let's say, cannot afford private health insurance, are not yet 65, so they don't qualify for Medicare. So it's sort of the catch in between. Now, there are other health insurance programs. These are the three big buckets. The other health insurance programs, there are separate programs for active members of the military or for veterans of the U.S. military through the VA. Those are substantial, not as large as the three big buckets. The last category I really want to focus on is how many people are uninsured. They do not have health insurance. So this number is, 28.7 million to 20.26.6. It's gone down. There was an upswing, but it's gone down. It usually goes down because more people have access to insurance through Medicaid as well. So it is a good thing that the number is down. It's a really good thing. That means this slide, right? Oh, this slide, it's not really a slide, is it? This number here, 92% of Americans have health insurance of some point, of some kind. So that's a good number. That's a good number. But there's still 26.6 who are uninsured. Now that level of an insurance can happen at any time. If someone loses a job, did layoffs, a month later, they and their family are uninsured, or they can't afford private health insurance because there's a cost. You talked about the premium cost and the deductible cost. So they might choose, not willingly, but choose to, out of necessity, to be uninsured. Um, so this is key because it means it's the ticket. If you don't have health insurance, it becomes almost impossible to access healthcare, any type, from prescription medication to urgent care to finding a nurse practitioner. Health insurance is the ticket to get in. I talk about it as the ticket to the dance. You're not going to the dance if you don't have a ticket. Um, but you need something to get in. So it's a key access issue. I want to um, ask you to look at one more thing, and this is the class activity. The class activity for today, and I'm going to ask you to do this, ask you to do a little research is to take a survey. Survey is on your Blackboard site. It's a class activity. And to find out what type of insurance you have or don't have today. Now, none of you are over the age of 65, so I gather that nobody has Medicare. But if you know that through your family you have public health insurance, Medicaid, I'd like you to click that. And then to find out what your total monthly premium is. And that could be for your family as well. So you're going to have to ask some individuals. You might have other forms of public health insurance, like I mentioned, active military. If a parent or even you have private health insurance individually because of an employer, you can click that. But if you don't have health insurance, you can click that. This is an anonymous survey. You just have to put your name down in the first page. Last name, names aren't matched with results. Much more importantly, um, if you can find out what your total monthly premium is, that means you're going to have to ask someone. And a ballpark number is fine. You don't have to the exact number. If you can get the exact number, that's great. Because we'll discuss this further and talk about the variation in the monthly premium. So that is your class activity because access now is two different things, right? It's having health insurance, being able to afford it, but it's so tied to income level, which is a uniquely American experience. Um, Apart from Medicare, obviously, all other forms of health insurance, private health insurance and Medicaid, or not having insurance is simply tied to income level and affordability. And so it's an important thing to really get a handle on. Okay, folks, so that is the content for the week. I'd like you to make sure you check out um, the brief reading on health insurance, but also inquire. You have until end of the day on Friday to complete this class activity. All right, thanks very much.